We are going to begin with breaking news. We're awaiting confirmation any minute now after a third person in Georgia has tested preliminarily positive for the coronavirus. Floyd County doctors say the 46-year-old woman showed up in the emergency care center with flu-like symptoms. These numbers just into our newsroom. There are more than 100,000 coronavirus cases now worldwide. Nearly 3,500 people have died here in the U.S., and there are more than 225 confirmed cases. 14 people have died nationwide. Our breaking news coverage begins in Floyd County right now. That's where CBS 46's Daniel Wilkerson is live outside the Floyd Medical Center in Floyd County. Daniel, what have you learned?
Well, they're in the process right now of contacting nearly a dozen people who may have come in contact with this virus here at this hospital. Meanwhile, they tell me that during the Ebola crisis that they built a special unit. Well, this patient is in that unit.
I can't catch my breath for nothing in the world.
Chris Spratling isn't feeling well.
I know I've got walking pneumonia again.
He's on his way into the Floyd Medical Center for the second time as of late. On the way in, he's hearing this.
Does that scare you going to the same hospital?
Sure.
That person has tested preliminarily positive for the coronavirus. The Center for Disease Control will have to confirm the results. If so, the 46-year-old woman will be the third person in metro Atlanta to contract the virus.
I've got to do it. I've had this, like I say, going on 7-8 weeks.
Kurt Stunkel, president and CEO of the Floyd Medical Center system, says the patient initially came in with flu-like symptoms into their emergency room Saturday.
This patient didn't have a travel background, as was indicated in the travel questionnaire.
Doctors treated and released her. They say she didn't meet the testing criteria for the coronavirus, which, by the way, is a series of questions. He says feeling worse, she came back Tuesday and more tests were done.
We contacted Public Health and said, here are the patient's conditions. We think that we need to do some testing. And they said, patient doesn't meet the criteria.
But thankfully, doctors didn't stop there.
Our clinicians did some further testing and said, we need to admit this patient. We went through testing and then finally got permission to submit testing to the state and the CDC for the coronavirus. And last night, late in the evening, we got a preliminary confirmation that it's positive.
At that point Tuesday, he says they had already placed her in their infectious disease unit.
It has a negative pressure, it has some anterooms, so that we can isolate a patient and then do what's called donning and doffing of the protective equipment and coverings that the caregivers must utilize.
As for Spratling, now that he thinks about it,
I could have it myself, but as far as I know, I don't know how it does or what the symptoms are or anything.
And we certainly hope he doesn't have it. Back out here live, the huge question at this hour, what about people who may need to be treated here? What about people who are being treated here right now? Well, the head of it all, who you heard from there, says the hospital is safe. We're live in Floyd County at noon. Daniel Wilkerson, CBS 46 News.
So, Daniel, I want to recap what you said at the top of this. There is a possibility that woman, who are waiting to hear if she does have the coronavirus positively, could have come in contact with at least a dozen other people.
Yeah, and those 12 people consist of the people who work here, the healthcare providers, as well as people who were in the medical in the emergency room when she came in. I've heard an estimate of nearly 24 people, but the man who you heard from there, who's head of the hospital, says that number is right at a dozen people.
All right, we're going to stay on top of this. Daniel Wilkerson, thanks so much.